Optimizing care will be about synthesizing lots of opportunities that digital offers us. It won't just be about the tax agenda, it won't just be about more effective transactions, it won't just be about managing your care record, it'll be about the synthesis of the totality of these opportunities that we have. In the context of this, I've taken a particular slice. I've looked at achieving an integrated digital care record. Our general practice primary care has had a level of digital maturity, and that's a refrain I'll come back to, that arguably you could say is the envy of the world. But there's still real opportunities within that for broader adoption, for more innovation, for change. Your experience going to a primary care professional will not feel as joined up and as comprehensive as it should be. And also, what, again, a refrain that I'll have over the course of the presentation is, in some contexts we've got, if you like, functional or installed capability for the techies, but what we don't have is some of those capabilities turned on, or we don't have enterprise-wide use of them. So you happen to be registered with one GP in a practice who's happy to use some of this functionality, but if you go to see the other GP, then unfortunately he or she's not as comfortable. But what I wanted to say is that fundamentally this is not a technocratic or an autocratic exercise. It's absolutely a hearts and minds, it's absolutely professionals, their attitude to risk. What we're looking for is safe digital record keeping here. There's still an opportunity to improve the workflows within organisations. So even the best organisations in this country at providing care don't optimise the capability that they've got. Some do very well, but even the best don't optimise it. We're not going to have 7-day-a-week work, and we're not going to have all of the innovation that we want if the professionals managing that environment are managing it with paper handovers and paper notes and everything captured only on paper. The patient as an asset is almost completely invisible to our system at the moment, and we're only going to enable that patient to be that transformative asset if we engage them much more effectively and we give them a window into the world of the information that's been retained and captured about them. And then moreover, we move to a stage where they can put the really high quality subjective additive information into that. And I don't just mean off their Apple Watch or their Fitbit, although that could be important. I just mean more comprehensively about where do I want to die, and is that going to be observed when it comes to management of my end of life? Who are the important people in my life in terms of carers? What's the social context in which I live and which I will be returning to if I'm in an inpatient, having an inpatient episode? Thinking about a future where in the course of the clinician's workflow, they're getting all of the flags and the alerts, they're getting all the hyperlinks to the relevant pieces of information pertaining to what best practice is in managing that individual's condition as we speak. Sometimes I think we're a bit lazy in assuming that professionals are resistant to this agenda. My experience latterly is that they're biting their hands off for this functionality. You know, we need this agenda to be owned at the top of organisations. It hasn't necessarily always been so. But we also need to create the mechanisms where the NHS can share its experience. We need to bring the market with us in this context as well. The NHS doesn't make these solutions, but I'm absolutely clear that if you were a supplier around the health record agenda or the integrated digital care record agenda, you have no idea what that route map is at the moment. But we also might want to get into a situation where you get a bit of bite around this agenda. So should it be the case that there's the license to operate in the NHS in the future is to be capable of sharing information, not just inside your organisation optimally, but also across and outside organisations. And should the regulatory and professional bodies around this agenda understand that 21st century healthcare means that healthcare professionals can no longer say, oh, I don't turn on the computer or I don't like using that. The Safer Hospital, Safer Wards Fund, which I'm responsible for, has had £260 million to invest in this agenda over the last 2 years. And then it was reshaped into the Integrated Digital Care Fund. Each of those funds was massively oversubscribed. And the calibre of application that we've had second time around is much, much richer and much, much stronger than the first time around. How do we make all of this sing and dance? So the NHS has to tackle this where board level leadership of this agenda. There's an increasing use of chief clinical information officers in the structure of NHS organisations, which we would say is a good sign. You need clinical ownership across the organisation. So again, these people are vital, but if their champions stood out on a pedestal but stood out some distance from the shop floor, then you're not going to get that buy-in from bedside to boardroom that you really need. We're trying with others to see that the level of IT expertise and capability across the NHS is enhanced and improved. But we're also pushing for an architecture that says you need open standards to support the movement of this information between care settings. There is high-level momentum around this agenda at the moment. Again, I won't describe the architecture to you, but the important thing is that this National Information Board represents all of the organisations across health and care that have an influence in how care is organised and delivered in the NHS currently. So that represents NHS England, the HSCIC, the TDA, Monitor, Public Health England, so that in principle you don't have divergence between those key players. You have synergy between them, and they understand each of their parts in delivering this agenda, and then they deliver it. There will undoubtedly be reference to the impact that technology and information technology can make in the NHS England's work currently on its 5-year forward view. We're in the middle of near-term planning ahead of a general election to make sure we can get through the next 2 years in a way which keeps momentum around this agenda, and also building the case for longer-term sustainability and investment. And as I say, the perfect loop in that is the evidence base that's generated from the transformation that people are making from the investment that's being made at the moment with them. I think that's all I want to say.
Thank you.